How do you take out a broken root tip effectively and safely? Broken root tips. The management of broken root tips is a really important topic in dentistry because broken roots can happen from time to time. What is a broken root tip? Well, you might come across it after you tried to take a molar out. You just put your forceps on the crown and you lever it back and forth as you're luxating and crack, you hear that awful sound. You take the crown off and you look down and there's your root tips left behind. You may come across root tips in different settings as well. Like you didn't try to take the tooth out, but the patient came to you and in a routine exam, you came across a root tip. Well, either way, those root tips typically have to come out, especially if they're infected. How do you take out a broken root tip effectively and safely? Well, remember that on the other end of that root tip, there is a person, and that person just heard the dreaded crack, and they potentially might have felt it. They're thinking all of the worst case scenario type things. So communicate with your patients effectively right away. No, Mr. So-and-so, everything's going really well. Take an up-to-date x-ray and maybe a photo. Continue to achieve hemostasis so that your visibility is optimized. Add in more anesthesia. Maybe now it's time for long-acting anesthesia like Marcaine. And then continue on with the procedure of removing the root tip. Well, how do you do that? You increase the flap, so you change your flap design so that you can see the socket better, see the entire periphery of the socket, create really good field of view. Then you can visualize the root tip. I like to use a very long diamond burr, or carbide burr for that matter, but something really long so that you can get into the depths of the socket. Create room around that root. And I typically like to remove the actual root structure itself or section it in half so that it implodes. And hopefully you can get all of the little bits of root out. When you're done, make sure you're suturing and achieving hemostasis. And the most important step for me is seat the patient up and spend a couple of minutes indicating to them exactly what you've done, why you did it, how you did it. Not every patient's going to want to hear details, but you know what I find? Every patient wants to hear some explanation of what happened. And when they're in their car ride home and they've got their gauze and they're feeling pretty good that they've gone through the procedure, they're going to be thinking back on that conversation, not about the broken root tip. Good luck with your next broken root tip. Hopefully you never have one.